to adopt the protocol so ably established. I want to extend a warm good afternoon to everyone. This afternoon, it's my duty to share with you the Health Emergency Operating Committee's situation report for today, Thursday, June 17th. The Federation of St. Kitts and Nevis is presently trying to contain the current wave of COVID-19 cases. Between May 19th to yesterday, June 16th, we have recorded 234 additional cases. So 234 cases have been added to the Federation's COVID-19 tally over this 4-week period. The graph on the right highlights the number of cases added daily. And so yesterday, June the 16th, we received positive results for 28 persons, inclusive of 26 positive cases related to inmates at Her Majestys Prison. The preceding day, on the 15th, we received 18 additional positive results. So let me repeat, over this 4-week period, we added 234 cases to the Federation's tally. During this time period, we have also had 25 cases recovering. So within this 4-week period, a total of 25 cases have recovered. At present, a cadre of case managers and physicians are monitoring 208 active cases. So at present, we have 208 active cases being closely monitored. Over this 4-week period, we've had 12 hospitalizations, COVID-19 related hospitalizations. Please note that 7 of these cases have since been discharged. So at present, we have 5 cases in hospital. And as the Honorable Minister of Health, Mrs. Akila Baron Nisbet, just highlighted, at about 12:14 this afternoon, we were notified of the first COVID-19 related death. This slide summarizes our current situation on the ground. So at present, St. Kitts and Nevis, we have reported 279 COVID-19 cases, 264 reported by St. Kitts, for St. Kitts, and 15 cases noted in Nevis. 208 of these cases are active, and as I said before, currently we have 5 COVID-related cases in hospital, and we recently noted our first COVID-19 related death. Now, just to provide you a summary about the outbreak, COVID-19 outbreak at Her Majestys Prison. So on June 9th, we identified the first case in this outbreak. On June 11th, we identified 8 additional inmates who were found to be positive. On June 15th, 2 cases. On June 17th, 26 cases. So in total, we have 37 inmates diagnosed with COVID-19. These cases have all been notified. These cases are being monitored as we speak. These cases have been separated from the general population. They are in the Her Majestys Prison. What's the way forward? And so we continue contact tracing in the prison. Other inmates who are experiencing symptoms will be tested. So there will be serial testing of inmates in Her Majesty Prison so that we can pick up additional cases at the soonest. All the cases that have been identified in isolation, all the implicated cells have been, well, 4 have been, the additional implicated cells will be professionally sanitized. And so we would continue monitoring all the inmates at Her Majesty's Prison at this time. With respect to the outbreak, at present, our overall aim is to flatten the curve. And as I said yesterday, we have employed there are 4 public health interventions that we have employed. We continue contact tracing, that's number 1. We continue testing. We continue our COVID-19 vaccination rollout. And then there is the restriction of movement over this 2-week period. Now, in terms of our vaccination rollout, as at end of workday yesterday, we achieved or attained the following coverage rates. So 66.3% of the target population has been covered with the first dose of the AstraZeneca Oxford vaccine, and 31% of the target population covered with 2 doses or fully vaccinated. So more specifically, 10,255 persons within the Federation are now fully vaccinated. And so this is good. This is a success because this just highlights the proportion of individuals with acquired immunity on the ground. This in and of itself will help to break the chains of transmission of the COVID-19 virus. And so I want to pause and speak to those of us who are virus-free or who have not been diagnosed with COVID-19. What can you do to prevent yourself picking up this virus? What can you do to protect yourself from this virus? So if you are not yet vaccinated, we want you to empower yourselves with the latest information or the facts about this vaccine. Come on board and accept the vaccine. We want you to wear a face mask at all times. It provides significant protection from the virus. Maintain adequate hand hygiene and maintain a safe physical distance of 6 feet or more from others when in the public domain. And then over this 2-week period, a period of strict restriction, we want you to stay at home for as much as possible, and you're only asked to leave if it's for an essential reason or purpose. Those who I want to speak to those who have been diagnosed with COVID-19. Now, what are the actions we recommend at this time? Well, first and foremost, we want you to continue boosting your own immune system, because this will help to facilitate speedy recovery. Make sure to eat and consume healthy meals with adequate or the recommended portions of fruits and vegetables. Make sure to maintain adequate hydration with simple water. Make sure to get adequate rest and exercise. Please note that exercise is a your last exposure to the case. And so this is very, very important. Next slide. We recommend that if you have any issues regarding your COVID-19 testing, you can call the 311 operator. And now I want to pause and speak specifically to persons who are fully vaccinated and who may be deemed contacts of COVID-19 cases. So if you are fully vaccinated and you was exposed to the virus, meaning in contact, close contact with a COVID-19 case, we want you to be tested. There's an initial test and a test 7 days post your last exposure to the COVID-19 case. So testing is important. Now, you do not have to particularly be in quarantine. However, we must test you, especially that last test 7 days post-exposure to the COVID-19 case. So that's very important for us to note. Ladies and gentlemen, this is real. We are in an outbreak. We are at war against this COVID-19 virus. We need all hands on deck, and we want us all to do our part in protecting ourselves. And so we need to vaccinate if we have not yet done so, and we need to be very serious about wearing the face mask, hand sanitization, and physical distancing. Each day when we receive additional positive results, it tells us that these individuals were not in full adherence to the COVID-19 prevention and control measures. So if you wear your face mask and you're very serious about that, diligent about that, maintaining hand hygiene, your risk of contracting the virus will be considerably low. And then chances are your name won't make the list of positive cases. So ladies and gentlemen, the one takeaway point is, if you are virus-free, do all you can to remain virus-free. Get vaccinated, wear a face mask, keep your hands clean at all times, maintain a safe distance from others. If you practice these measures, you can and will remain virus-free. If you practice these measures, you will be doing your part in helping us to get out of this crisis. Let us all come together and fight this virus and contain this outbreak. I thank you.